HRB's new strategy doesn't actually get launched officially until Tuesday of next week. But as you are all very much our key stakeholders, we're giving you a preview, looking in particular at those aspects of the strategy that you're interested in and that impact you, in particular around funding and building a thriving health research environment. And hopefully many of you will be able to participate next week in the launch as well. Okay, so let's start by looking at the context for the strategy. And of course, we are launching it in the middle of the COVID-19 pandemic. And never before, I suppose, have we demonstrated or seen demonstrated such a clear link between people's health, the capacity of our health and social care system, and the economy. And we've also seen the importance of our public health system, the importance of evidence-based policy, and the need to better integrate research into policy, and how best can our research and academic communities work with policymakers to influence policy, and the role, of course, of scientific advice in shaping public policy. And in fact, this is the theme of a series that's currently being run by the Royal Irish Academy and the Irish Research Council. If you want to check it out, it's very interesting. Of course, we also have Sláinte Care, which sets out a new direction for our health system. That's about reorienting our healthcare system to ensure equitable access. It also recognises that the vast majority of healthcare actually takes place in primary and social care settings. So it's all about moving the focus away from hospitals and towards community-based care. And of course, related to that, we have demographics, the reality of an aging population, which means looking at care models. It means looking at the increase in chronic diseases, for example, and multimorbidity. We also have some very positive developments in the health service. For example, the HSE has a new research governance framework, which hopefully will be signed off shortly, which is very good news. And increasingly, we are seeing, and this is quite a big theme in our strategy, the importance of health and social care data. The way that health and social care data has the potential to transform the way healthcare is delivered, as well as how we manage our own health. There are plans from the Department of Health for a national health information strategy. Hopefully progress will be made on that this year, and that's all about optimising the use of data for health. And at European level, one of the priorities for the European Commission is the creation of a European health data space, which again is about sharing data across Europe for better treatment and public health, but also for research. And once you talk about data, then issues of trust are never far behind. We can see the importance of engaging patients and the expectation now that patients and the public will be involved in health research at all different levels, the importance of citizen engagement in research. And we've already seen, I think, with COVID, the great interest that the public has in research advances in relation to treatments, vaccines, and so on. So the question is, can we build on that? Can we build on the support of the public for research? And how can we engage the public better in research and in science? And of course, there are many other developments that we could touch on as well around genomics, personalised care, and personalised prevention. But if we zoom out for a little bit now and just look at the developments more broadly, and particularly around our national research system, because of course health and health research is part of that. And there was a significant development last year with the establishment of a new department, DFERIS. So this is the first time we have a government department that is dedicated to higher education and to research. And this is a great opportunity for a more coordinated approach across the whole health research system, And we are hoping, I think, for a very strong focus with the new department on cooperation and on taking a whole of government approach to research. The first job for the new department, of course, is to develop and implement a successor to the Innovation 2020, which is the national strategy for science and technology for research and innovation in Ireland. That's due to be drafted in the first half of this year and indeed published later in the year. And I think the expectation is that that will be a 7-year plan, then with shorter 3-year work programs. You probably remember last time the Innovation 2020 strategy had a very strong focus on enterprise and industry. I'm sure that will still be there in the new strategy, but hopefully that will be balanced by a stronger focus this time around on research for society and research for public policy. Of course, we're never far away from Brexit. We have to mention that as well. It is a reality. It means focusing much more on East-West relations and indeed on all-island research. Another big development this year is Horizon Europe. Horizon 2020, of course, ended last year. And there's a much bigger budget this year for the EU for Health programme. That's a successor to the public health programme, so you'll be hearing more about that. Other developments, there is the establishment, very welcome establishment of the technological universities we had last year at TU Dublin. And I think this year, Munster Technological University is due to be designated shortly. And there's a real drive across the whole system towards open science and open research, and issues like research integrity taking central stage. And I suppose overall there is a need, and I think a growing acknowledgement of the need to increase the overall national investment in research. And if you just take a look at this slide, you will see that government investment in research as a proportion of total government spend is now less than about 0.9%. And if you look over on the right-hand side there of that picture, you'll see that Ireland is one of the poorest performers in the EU and well below EU average. So that's a kind of a joint or a shared responsibility, if you like, for all of us in Ireland and for public policy to try and increase the overall investment in research in Ireland. And we're looking forward to working with the new department to try and make some progress on that. Okay, let's go back to the HRB strategy and talk about that. It's against that context, I suppose, all of those developments that I just mentioned and more, that we started to develop our strategy over a year ago. In fact, we had quite a bit of it done before the COVID crisis struck. Certainly we had done the stakeholder, internal and external stakeholder engagement, and we'd also convened an international expert panel as well. And out of those, there were a number of emerging themes and potential themes. And we then put that through a sort of an iterative process, I suppose, between ourselves and the HRB, our own board, Department of Health, to shape that and to identify a number of strategic objectives and key actions, and of course an associated work program as well. I think in total we had about 400 different inputs to the strategy process. So it was a long process, but it was very thorough, and I think it was a very good process. And I suppose, as with all strategies, it's an opportunity not just to identify the key actions and objectives for the years ahead, but also to refresh our vision and mission, and to think again about the values that underpin our work. And so, setting it out here on this slide, you can see our vision for the next 5 years as being better health through excellent research, data and evidence. And what we're here to do, what the HRB is here to do, is to support research that improves people's health, promotes evidence-informed care, and create solution to societal challenges. And I think above all, that vision and that mission reflects the unique position that the HRB is in as a mission-oriented agency. It's all about health, but positioned at the interface of the academic and the health systems. And I think that's a particular strength of the HRB. So to get there and to realise this mission, this vision and mission, we have set out 6 interlinked and mutually supportive objectives. And most importantly, I think we want to be clear that at the heart of this strategy, we are putting the voice of the public, of patients and carers. And that's very much because public trust and confidence are absolutely essential for health research, as you will know. The HRB has already led the way in Ireland in public and patient involvement in research, and we're absolutely committed to continuing that and indeed developing that further over the next few years. Okay, so let's take a look at these objectives, first of all, starting with the first one. The first one is around our funding aims, or at least a significant part of our funding aims. It's about investing in research that delivers value for health, the health system, society and the economy. And we have shortened that, in other words, to research that makes a difference, funding that makes a difference. What do we mean by that? Well, we're aiming here for stronger collaboration, coordination and prioritisation, particularly stronger collaboration and coordination across the health system, and looking at the integration between the health system and the academic system. We are looking at a balanced funding portfolio, so that is research that informs decisions and actions in the health and social care system, but importantly also a continued commitment to high quality investigator-initiated research that has value for society and the economy. We are looking to an investment that involves, as I said before, public patients and carers in different aspects of HRB funded research. And we are very interested in the way we fund, looking at the way we fund, making sure that we are meeting best international practice and indeed in some cases leading practice. So we're looking at excellence in health research practices, and we're looking at measuring the return on investment and demonstrating impact, the impact of the work we fund. Moving on to the second objective, we aim to be an independent, credible voice for research and evidence and a trusted thought leader, an independent voice for health research. So what do we mean here? We are setting out to achieve a national, a structured and a coordinated approach to evidence synthesis. Some of you will be familiar with the fact that the HRB, we have our own evidence centre in the HRB that provides an evidence service to the Department of Health. We also fund other evidence supports throughout the system, and so we want to make sure that all of that work is structured and coordinated at national level. And a very big drive to make sure that Ireland has the capacity to support evidence-based policymaking in health and social care. And what we're trying to get to here is to see research and evidence embedded in key decisions for health and care services and underpinning health strategies. And what that means as well is raising the level of knowledge and raising the level of awareness of the importance of evidence synthesis at all different levels. And overall, we are aiming in the HRB to be a trusted and an objective source for health research and evidence and data. The third objective we set out for ourselves is to promote and enable the use of data to help to shape health policy, to enhance healthcare delivery and drive broader research and innovation initiatives. So this is all about trusted data. This is a very big agenda. It's an important agenda, obviously, as I've said before. What we're aiming for here is to see national and applied data infrastructure that supports research for health, social care and well-being. There's also a number of, I mentioned before, a number of initiatives going on at EU level, particularly around European health data space. We want to be an active partner in those initiatives. We have, again, some of you will know, and you've probably worked with our own national health information systems here in the HRB, very much focused in the areas of drugs, disability and mental health. And we want to see our own national health information systems supporting policy planning, service delivery and, very importantly, research. We want to see HRB data and evidence inform the implementation of the national drugs and alcohol strategies, because they are areas of expertise within the HRB. Very importantly, we want to see that patients, members of the public, researchers and policymakers all have confidence in the way that health data are used for research. This is really, really important. It goes to the heart of health research and having a good health research system. And we want to see health research and data in Ireland being open and fair. Our fourth objective is all around the environment for health research in Ireland, and we've done quite a bit of work on this already, and we're going to continue and expand this in the next 5 years. So we are aiming here to build a strong and supportive environment for health research in Ireland, and that's about developing a thriving research environment. This is about the people and it's about the infrastructure. So first of all, looking at the people, we want to invest strategically in research leadership and also in capacity. And that's in the people and the talent. We can't go anywhere if we don't invest in talent. It's so important to invest in people. And so we will be continuing our support for training programs and research fellowships at all different levels using our health research career framework. We want to invest in a coordinated clinical trials infrastructure, very importantly one that is integrated into the health system. And over the next 5 years, we see further integration taking place into the health system, so that it's not just seen as something that's the responsibility of the HRB. We want to make progress on national shared high cost research infrastructures. And what do we mean by that? We mean, for example, in areas like biobanking and genomics research. And this is something we really need to make progress on as a matter of urgency in Ireland, but it is very much something that the HRB cannot do on its own. We have to work with others to do that and to put those infrastructures in place. We've already started transforming the national research ethics system in Ireland through the establishment of the national office in the HRB for NRETs, and we want to continue to lead the transformation of the national research ethics system. And we want to develop and shape health research related policies, regulations and procedures and look at their implementation in Ireland. Our fifth objective is around collaboration. This is a huge area of the HRB, really important area, and particularly around European and international coordination, collaboration and engagement. I think we have seen that there are some things that you just have to do in collaboration with partners, and it's really important to put those structures and systems in place. So this is all about productive international partnerships. So we will continue and expand our role partnering in EU and international health research and policy projects, particularly those that address priority challenges. I mentioned earlier the establishment of, or the launch, I suppose, of Horizon Europe. We will, in the HRB, aim to have an expert understanding of that landscape. We, I think, made a very big contribution to Horizon Europe, or sorry, to Horizon 2020. And we will continue to do that for Horizon Europe. And we're aiming here to use systematic horizon scanning and certainly engage with key stakeholders. We want to see the Irish health research community and policymakers compete successfully in Horizon Europe and, importantly, in the EU for Health programme, and we'll be putting structures in place to try and do that, and also, of course, working across the system with other funders and other government departments. And very importantly as well, we want to engage with and contribute to the aims of the 2030 Agenda for Sustainable Development. So that's looking beyond Europe and looking at our responsibilities as a funder, and indeed our responsibilities as a research community to that agenda. Finally, I just wanted to mention the last objective, which is a more internally focused one, but it is an important one as well, and one that you will interact with. It's all about developing the HRB as an organisation, as a progressive place to work, and supporting the people in the HRB to be innovative and responsive. So in other words, it's about organisational excellence. We want to promote a positive organisational culture. We're aiming for high standards in our corporate governance. It's very important because we are funded by the taxpayer to deliver value for money and obviously optimise our financial operations. We're very heavily reliant on ICT, so we want reliable, resilient ICT systems that are cyber secure and focused on digital innovation. And as an organisation, we have our own responsibilities around climate, so we want to set out to deliver on ambitious sustainability and climate action goals. And finally, of course, we will be working, as always, to enhance communications both internally and externally with the community. I just want to say a few words at this point and finish by saying a few words around values, because, of course, how we work is just as important as what we do. We see the HRB as leaders in terms of raising the standards of health and social care research and evidence and data nationally. We very much see ourselves as an independent and trusted voice. We want to be an independent and trusted voice for research evidence in health and social care. We want to stress our accountability. We're accountable for the research we fund, the research we do in-house and the data that we manage, and we are committed to quality standards. And we want very much as an organisation to be agile and innovative in how we respond to the research needs of society and the health system. And as I mentioned before, a huge part of our work is around collaboration nationally and internationally. A lot of the things that we want to do can only be done in collaboration, whether it's with the health system or with other funders, or indeed with yourselves in the research community. So we'll be putting a very, very big focus on that. And finally, we aim to be inclusive. We want to engage positively with a diverse range of people. And as I said earlier, make sure that we put people, patients and carers at the heart of everything we do. Thank you.